What up, though? Welcome to another episode of NEMT for Dummies. I'm your host, Dante, and in today's video, we're going to talk about, this episode is specifically talking about NPI application and what entails about the NPI, basically the whole infrastructure. So you might want to sit back and take a few minutes and sit with me as we take a deep dive into the NPI application and what does it entail. See you on the flip side of this video. Hope you enjoy it. I'll see you soon.
Welcome back, everyone, for another deep dive. This time we're tackling a topic that's behind pretty much every interaction you have with the healthcare system, the National Provider Identifier.
The NPI.
Or NPI for short.
Right.
And we'll be using the official NPI application update form as our guide today.
Sounds good.
Have you ever wondered how your doctor or even the hospital itself gets that unique ID? Well, we're going deep into how that works today.
It's a fascinating system, really.
Yeah. So joining us today is...
I'm an expert on healthcare data and policy, and I'm excited to break this down.
Awesome. Okay. So let's start with the form itself.
Okay.
It seems pretty straightforward, at first glance, but I'm guessing there's more to it than meets the eye.
Absolutely. Getting the details right on this form is so important. It's not just paperwork. It's about making sure you're recognized by insurance companies and avoiding problems later on.
So if your NPI info doesn't match what the insurance company has on file, then your claim could get
Lost in the system.
lost in the system.
Yep.
Wow.
That can lead to delays or even denials.
Okay, so we definitely need to pay attention to the fine print.
For sure.
So who exactly needs to fill out this form?
Yeah.
I'm assuming it's not just for doctors, right?
You're right. We're talking about a whole bunch of healthcare providers, both individuals and organizations.
Okay, give me some examples.
On the individual side, you have everyone from dentists and pharmacists to physical therapists and nurse practitioners.
Okay.
Basically, if you're directly providing healthcare, you need an NPI.
Makes sense.
On the organization side.
Yeah.
We've got a wide spectrum, too.
Okay.
Hospitals, of course, but also ambulance companies, nursing homes, group practices, even a mobile imaging unit would need an NPI.
Got it. So basically, if you're in the business of healthcare, you need one of these numbers.
Exactly.
Now, I've heard that incorporated individuals can actually have two NPIs,
Mm-hmm.
one for themselves and one for their corporation.
That's right.
Why is that?
Well, there's an important distinction between the person and the professional entity, right?
Okay.
Especially for things like billing and liability.
Okay.
So let's say you're a physician who's incorporated. You would use your individual NPI when submitting claims for services you personally provide.
Okay, and then the corporation's NPI would be used for?
For any services provided under the umbrella of the corporation, think administrative costs, equipment, or services delivered by other practitioners employed by the corporation.
So it's about keeping those financial streams separate.
Exactly, yeah.
Interesting how much complexity is packed into a seemingly simple identifier.
It is.
Now, what about sole proprietors? Say, a therapist running a private practice.
Right.
Do they fall under the individual or organization category?
They're considered individuals for NPI purposes, even if they have an EIN for their business.
Well, that's interesting.
Yeah,
So even though they might think of themselves as a business, they're treated differently in this system.
that's right. And that has a specific implication for the form. Oh.
Even with an EIN, sole proprietors must use their Social Security number when applying for their NPI.
Okay. That's good to know for any listeners out there running their own healthcare practices.
Oh, yeah? Important detail.
Now let's talk names.
Okay.
Is it as simple as putting down your name and calling it a day?
Well, not quite.
Oh.
The form really emphasizes using your full legal name, even if you go by something different professionally.
So let's say I'm a doctor and I go by Dr. Jones, but my legal name is I don't know, Archibald Bartholomew Jones III. Do I have to write all that out?
You absolutely do.
Yeah.
Legal name is the foundation here.
Wow.
But there's a section for other names where you can list your professional name, any former names, other variations.
Okay, so the system needs to know your official identity, but it also recognizes that people, operate under different names in different contexts.
Exactly.
Okay, so we've got the name sorted out. What about location? How much detail do they need?
Location has two parts on this form.
You need a correspondence mailing address and a business practice location address.
So where you get your mail versus where you actually see patients.
Exactly. And if you practice in multiple locations, you'll pick one as your primary.
Makes sense. So you're establishing a central point of reference for all things NPI related.
Right.
So we've covered who needs an NPI, how to handle names and addresses.
Uh-huh.
But this NPI seems to be more than just a simple ID, right?
Right. This is where we move beyond just identification and into how the NPI acts as a key that unlocks different parts of the healthcare system.
Unlocks. In what way?
Well, think about it. Your NPI is connected to your credentials, your billing information, your specialty,
Yeah.
all these like data points,
Okay, so that information needs to be accessible to different
players in the system.
players in the system.
We're talking insurance companies, labs, pharmacies, other healthcare providers.
So they all need a reliable way to
Identify you.
identify you and access the information they need.
That's right.
Okay, I'm starting to see the bigger picture here. It's not just about having a number. It's about having a number that's connected to a whole network of information.
And that's what makes the NPI so important. It's a foundational element in this complex web of healthcare data. And this is where things get really interesting.
Okay, so we've talked about how the NPI is more than just a number. It's a key that unlocks this complex web of healthcare data.
Right.
But for the average person, like, why does this even matter?
Imagine you're going to see a new doctor for the first time.
Okay,
Okay.
walking into the waiting room.
Yeah, you hand over your insurance card.
Mm-hmm.
The receptionist enters your information.
Standard stuff.
Now, behind the scenes, the system's using both your insurance info and the doctor's NPI to verify everything and to kind of get the ball rolling.
So it's like while I'm filling out paperwork, my insurance and the doctor's NPI are having their own little digital meet and greet.
Exactly, and it all happens without you even realizing it. That check ensures that the doctor is in your network, and it helps streamline the billing process later on.
Okay, so it's not just about making sure the doctor gets paid.
No.
It's about making sure the right information is flowing between everyone.
Right.
Okay.
And this becomes even more important as you move through different stages of care.
Okay.
Let's say your doctor orders some blood work.
Happens all the time.
When the lab receives that order, they'll also receive the doctor's NPI.
Okay.
This helps them track where the request came from and process the billing correctly.
It's like a little breadcrumb trail
It is. It is a breadcrumb trail.
through the healthcare system.
And that trail is essential for everything from basic record keeping to tracking healthcare trends and outcomes on a larger scale.
So it's not just about me and my doctor.
No.
It's about this whole interconnected web of information
Exactly.
being tracked and analyzed.
Yeah.
Okay, so how does this connect back to the NPI application update form?
Well, this form is where that crucial NPI data comes from. It's the starting point for that digital breadcrumb trail.
And if the information on the form isn't accurate?
Then the whole system gets thrown off.
Oh, no.
Claims might be delayed,
Oh,
care could be disrupted, data analysis could be skewed.
okay. Suddenly this form feels a lot more important than it did at first glance.
It is important.
Now there's a section on the form called Other Provider Identification Numbers.
Yeah.
What's that about?
That's about making sure that your NPI can, talk to other systems.
Okay.
Health plans often have their own internal identification numbers for providers.
Right, so it's like creating a bridge between systems that might not otherwise speak the same language.
That's a great way to put it, yeah.
Okay,
It ensures that no matter what system is being used, your identity as a provider is consistent.
cool. And that brings us to the Provider Taxonomy Code.
Yes.
This one sounds kind of intimidating.
It's simpler than it sounds.
Oh, good.
Think of it as a way to categorize healthcare providers by their specialty.
Okay.
Each specialty has a unique 10-digit code.
So there's a code for cardiologists, a code for pediatricians, a code for...
For everything. There's a whole website dedicated to these codes.
Wow.
It's very extensive.
So instead of having to write out psychiatrists specializing in adolescent anxiety disorders,
Right.
there's a code for that.
Exactly. It's shorthand that everyone in the healthcare system understands.
Got it.
And for some practitioners, like physicians, dentists, and nurses, the form also requires their license number along with their taxonomy code.
Okay, so it's about making sure everyone is properly qualified and categorized within the system.
Yes.
I see how these seemingly small details in the form actually play a big role
They do.
in how healthcare works.
Yeah.
Now, I'm curious about something called subparts.
Okay.
What exactly are those?
Think of a big hospital with different departments.
Oh.
You've got cardiology, oncology, the ER.
Uh-huh.
Each of those can be a subpart.
So it's like a mini NPI within a larger NPI.
Exactly. Each subpart can have its own NPI and taxonomy code,
Okay,
separate from the hospital as a whole.
that makes sense.
This allows for more specific identification and tracking within a complex organization.
Okay, so we're seeing how this NPI isn't just about identifying individuals.
Right.
It's also about understanding the relationships and structures
Within an organization.
within organizations.
Yeah.
Now, the form also mentions the importance of an authorized official
Yes.
for organizations.
Uh,
What's that all about?
Well, when an organization is applying for or updating its NPI, someone needs to sign off on the information
Okay.
and take responsibility for its accuracy.
Okay.
That's where the authorized official comes in.
So it can't just be anyone.
Right. This person needs to have the authority to represent the organization.
Okay.
We're talking CEOs, CFOs, executive directors.
Got it.
Someone with the power to bind the organization to the information on the form.
And I'm guessing there's some pretty serious consequences if that information is false.
Absolutely. The form's very clear about the penalties.
Oh, wow.
We're talking fines, imprisonment.
Wow. Okay.
It's serious.
That definitely underscores how seriously the system takes accuracy and accountability.
It does.
Now, I'm curious about something else. We've talked a lot about how this NPI connects to sensitive information. Are there safeguards in place to protect patient privacy?
That's an important question, and yes.
Okay, good.
The NPI system works within the framework of HIPAA,
Pape, that's...
the Health Insurance Portability and Accountability Act.
Okay.
It's all about protecting patient privacy.
Okay.
It sets guidelines for how healthcare providers and organizations can use and disclose protected health information.
So even though the NPI helps connect all this data, it doesn't mean that anyone can access everything.
Exactly. There are rules in place to make sure that sensitive info is only accessed by those who need to know.
Okay, that's good to know.
Yeah, it's a delicate balance, but one that the healthcare system takes very seriously.
Good. This deep dive has been really insightful.
It has.
We've gone from what seemed like a simple ID number to understanding its role in billing, care coordination, data tracking, and patient privacy. It's fascinating how these small details can have such a big impact on healthcare.
Yeah, it is.
All right, we're going to take a quick pause here, but when we come back, we'll continue exploring the NPI.
Okay.
We'll be looking at its role in the bigger picture of healthcare data and what it all means for you. Welcome back to our deep dive into these NPIs.
NPIs.
We've uncovered how this seemingly simple identifier is actually like a key, unlocking all this healthcare data from billing to care coordination to patient privacy.
Right.
What does it all mean for the bigger picture of healthcare?
This is where things get really interesting.
Okay.
You know, as we move towards a more data-driven healthcare system,
Yeah.
the role of the NPI is only going to become more important.
I'm listening. How so?
Well, just think about all the data that healthcare generates every day.
Yep.
We've got electronic health records, insurance claims, lab results, prescriptions. It's a ton of information.
It is, and the NPI helps to organize and connect all of it.
Okay.
This allows researchers and policymakers to analyze trends,
Okay.
identify areas for improvement, make better decisions about healthcare delivery.
So the NPI is helping us go from a system of like individual interactions to a system that can learn and adapt based on data.
Exactly. We can start to see patterns emerge that we might not see otherwise.
Like what?
Well, for example, we can track how certain treatments are performing across different populations.
Right.
We can identify areas where there are healthcare disparities and even monitor things like the spread of diseases.
So it's like we have this bird's eye view of the entire healthcare landscape.
Yeah. And this is just the beginning.
Oh.
As technology gets more advanced, we can expect even more sophisticated uses of this NPI data.
Like what?
Well, think about things like artificial intelligence and machine learning.
Okay.
These can analyze these massive data sets and maybe even help predict outcomes, personalize treatments, and prevent diseases. Wow, so the NPI isn't just about the present, it's also about the future of healthcare.
It really is. It's a building block in a system that's always changing and becoming more data-driven.
I never would have thought that something like an NPI could be so important.
I know, it's fascinating, right?
It is. It's a good reminder that even the smallest details can have huge impacts.
That's for sure.
For our listeners who want to learn more, we'll put a link to the NPI website in the show notes.
Yeah, it's a great resource.
So as we finish up our deep dive, I want to leave you with one final thought.
Okay.
Now that you understand how this identifier connects you to so much data, how does that change how you think about your own healthcare?
Yeah, what questions do you have about how your information is used and what do you see for the future?
That's all for today's deep dive. Thanks for joining us.
Thanks, everyone.